This is some of the proposed mechanism, because in Siddha, this Varma is mostly applied for the alleviation of pain. So there are some of the studies that's been conducted, how this system works, the Varma, how it alleviates or removes pain. So there are two mechanisms proposed found to be close. That one is the gate control theory, that's the physiological theory. It is, we do have within our system, it is potentiated by the Varma stimulation. You can know the first one, the gate control theory, the pain that carried all the way to the pain sensing area of the brain. So there are some neurotransmitter which arises from that, which comes back and try to peptides, which comes back and inhibit the pain carrying fibers. So that is the where it happens when you give a Varma. That's one thing. Then all of you know that we have an analgesia system. Human body has its own analgesic system. You may be aware of it. It is containing like enkephalin, all that is there. This balance, that's why the pain intensity of the person vary with the individual because of this analgesic system. Some person react very fast or short for pain, but other person just ignore. So it happens that the intrinsic, the mechanism, how it works basically. So Varma tried to potentiate that, basically the Varma stimulation, which can increase this, our own internal analysis system and try to help to manage the pain. So that's the thing they proposed here. Then another interesting thing or the uniqueness of the system is the Tokkanam, the physical manipulation. It is called many other names basically. It is called, there are 9 types of Tokkanam has been given based on the way they are doing it, like a tattal, then irikal, there is a compressing, gripping, grasping, holding, or twisting. So it depends upon the requirement, they do that actually. And pulling, supination, there is changing the body position and giving some pressure over that, pressing, shaking, or mobilizing, all the circumstances like that. So this Tokkanam are helpful to nourish the body cell and improve the sleep and sexual function. They also helpful to relieve the body pain and tiredness, and they also tone up the skin, muscle, and nerves simultaneously. Again, it is 2 types. Sometimes they apply oil, without oil, they do either way. That is depends upon the requirement. Recent studies have proven that it improves the blood circulation. Also, it facilitates the lymphatic drainage of that actually. Okay. So this is another one uniqueness of the Siddha system of medicine. These are some of the external therapies. It is kind of surgery that's advocated in Siddha. We call it as a Cardinal Therapy. Basically, medicated thread used as a chemical catalyzation. Basically, it is applied in the anorectal disease, fistula in ano, hemorrhoids. So they clean up and they apply this caustic substances. The thread that is smeared with this, and they apply over that, which is helpful to cut and close the tracks. Basically, that's what it does actually. That's the Cardinotherapy. Here I want to say about it, because Ayurveda, they call it the Shala Sutra. You maybe heard about it. So I'll come to the end of the talk. I come to that where this Siddha and Ayurveda, why the similarities and why the differences, that we'll discuss further. Then again, the leech therapy is one of the unique procedure applied for therapeutic purposes. Leech therapy, now it is all over the world. I think FDA also approved this procedure now for many things. It is one of the old method that is applied to for the rheumatic edema, tumors, and abscess, pains, eczema, and other conditions. So one more thing is a Sooty, that is a cauterization, this one. It is one of the external therapy followed in Siddha system of medicine. They use the specialized instrument or a herbal trick, so to apply over that in the skin tag and what they do apply this to remove this condition. Siddha's medicine and immunity, because I think tomorrow you have a talk on this. I don't go in detail about it. You know about it. Dr. Meena Kumari, our director, is going to talk about that Siddha medicine, how it enhances the immunity. So generally, by advocating the good lifestyle, yogic practices, medicinal plant usage, some of the home preparation found to be effective in the enhancing the innate immunity of the human being. So tomorrow you may know more in detail. I don't go into detail about that. So in conclusion, I say that Siddha is an holistic medicine. The strength of Siddha lies on its physical and mental, social, and spiritual well-being. By adopting a simple lifestyle practices like postures, breathing exercises, meditation, dietary regimens, and relevant to the 6 days. Then it also uses safe, effective plant-based drugs and drugs of mineral and animal origin, which is adaptable to the universe basically. Then it also gives a unique therapies like Varma and Tokan, which helps to give a sophisticated treatment. Also, worldwide we have a qualified and skillfully trained Siddha physician nowadays, so which all together gives a human community a great medicine to all in the preventive as well as the treating the disease. With this, I conclude. Thank you for the opportunity. I should thank my directors who has allowed me to give a talk on that. My special thank to Vinayak Nair and initiator and chairman, and also the team, the organizing team, Knowledge Festival, Open. Thank you one and all.
Thank you, BRF.
Thank you, Shankar Narayana. Thank you.
Okay, thank you.